After earning a master's degree in hospital administration at the George Washington University, Elliot Roberts was selected for leadership positions at Mercy Douglas Hospital in Philadelphia, Harlem Hospital Center in New York City, Detroit General Hospital, and Cook County Hospital in Chicago. He also served twice as the head of Charity Hospital in New Orleans. Assignments at these leading safety net hospitals were challenging. Mr. Roberts arrived at Detroit General Hospital during the time that it was being reorganized to become part of the Detroit Medical Center. The Cook County assignment came at a time when County Hospital had serious financial difficulties, and his first week on the job at Big Charity in New Orleans was marked by labor unrest. Elliot Roberts has been committed to teaching throughout his career, and even after retiring, he helped establish the School of Public Health at Louisiana State University. Among the honors and awards accumulated over a distinguished career have been inclusion in the National Association of Health Services Executives Hall of Fame and the Modern Healthcare Hall of Fame.
I would say to you that there is no field, there's no professional field that is as rewarding as work in the healthcare field, and certainly in hospitals. It's really a unique exposure, and I would recommend it to anyone at this stage of the game. But again, to carry on, I was at Provident, and one of the staff had attended a meeting in D.C., what we call our district meetings, and brought back a flyer which indicated that George Washington had started a program in hospital, George Washington University in D.C. And I immediately jumped at that and applied and was in fact accepted.
What year was this?
This was in 1960, had to be 59 or 60.
It was pretty progressive at the time to accept an African American applicant.
Well, again, in those days, this was a new program. I was the only African American in the program, but it too was one of the largest programs available at the time as a new program. It's probably fair to say that the programs that existed probably accepted somewhere between 8 and 10 students at a time because it was a new field. Remember, at the outset, hospitals were run by physicians.
And sometimes nurses.
And sometimes nurses. No, not then. Not then.
In rural areas.
Maybe in rural areas, but it was largely a physician-owned and dominated field. They started the hospitals, they owned the hospitals, they ran the hospitals. As the management and the operation became more complex, it became more important to begin to look at individuals and require training in management to in fact operate them. And this is how the programs on hospital administration came into being. In fact, the programs that were started by physicians, Dr. McEachran being the main individual who in fact opened the field up. Where'd I leave off?
So you decided to go to GW?
Went to GW and completed that program. Commuted back and forth from Baltimore to Washington. Did it on a part-time basis. Did it over a 3-year period. And did it within 2 institutions because when I started, I was at Provident, and in the course of the study, accepted a job at Crownsville State Mental Hospital. Hospitals were segregated at that time. Crownsville was a state mental hospital for blacks. And the superintendent, who had newly arrived, was attempting, and right about this point in time, the concept of integration was being discussed, and he was anxious to integrate the hospital, and he wanted to begin by doing it with staff, and so he was looking for someone to be his assistant, and he asked me in, and the interview went very well, and
Was he African American?
no. Dr. Ward was a physician and a Southern gentleman, if there ever was one, and very accommodating and understanding of the situation at that time. He had, when he interviewed me, my having received the notice was well after he had initially put it out. He had actually already made a selection, but he was interested in me and asked me to keep in touch as he continued to try to fill vacancies at the hospital, and did not select me for the assistant spot, but over time and multiple visits finally found a spot that I fit into, which was accounting. And that's the position that I joined him. That was the position that he gave me that I accepted when I went there. And
What was his full name?
Dr. Ward, Charles Ward was his name.
Thank you.
And I stayed there at Crownsville, graduated from GW
In what year?
in 1963. And on graduation, it was very, not amusing, but pleasing to me. I came in one morning to the office, and as usual, I stopped by the secretary's office and see how he was and see how she was. And she said, "Oh, by the way, Dr. Ward asked me to tell you to take the office across the hall," which was the assistant superintendent's office. And that was my move into the position that he had wanted from me for so long.
So he just was waiting for you to graduate.
Waited for me to graduate. He was most supportive in terms of my continuing my education and my work with him and at the hospital. And this was his way of saying thanks, and it was most appreciated.
Elliot, you were, I presume, the only African American in your class or in the entire program during your time at GWU?
For the 3 years that I matriculated, there was one individual from India, but he was the only one with dark skin other than myself.
Was that uncomfortable for you? I mean, you must have been used to it to a degree. But...
Well, recognize that at this point in time, I'd already served 2 years in the military as an officer, and the military was integrated, and the ability to work in mixed settings was most comfortable to me by this time, as compared to having grown up in a completely black neighborhood.
Were you don't have to answer the question if you don't want, but did you encounter overt discrimination during the course of your education at GWU?
Oh, no, definitely not. Not by a long shot.
And so you went to Harlem, which is a difficult post under any circumstances. A teaching hospital, a member of one of the most arcane organizations that ever existed. So do tell about your time at Harlem. You went in as CEO, right?
I went in as CEO. New York City, in terms of progressing to the current age, was attempting to create the New York City Health and Hospitals Corporation from what was previously known as the Department of Hospitals, an attempt to take the operation outside of city government. That had been in a 4-year planning period prior to my arrival.
So you went in
And-
'69, so they were in the middle of all of that.
They were just coming towards putting the final pieces to bed. The leadership there was through Joe Terenzio, and he had a fantastic team working with him. And the city had 18 hospitals, and Joe Terenzio had nicely, effectively recruited all of the individuals to run those hospitals. And I was fortunate to be among that group. The unfortunate thing was that shortly after the initiation, Joe and the Mayor Lindsay at the time, ran into a disagreement in terms of the selection of at least one individual for Lincoln Hospital, that the Hispanic community wanted to be selected. And Joe insisted that the individual was not qualified and did not agree to the selection, which caused Joe to terminate his relationship, and he abruptly resigned. And this created some turmoil because the leadership that he had put together, literally one by one, left after he did. And my time there was from '69 to '72, and I too left shortly thereafter and went to Detroit to accept a position where the city was attempting to go through a major change as well, to change the structure from a city operation to a public benefit type corporate structure.
So the Detroit Medical Center, which of course has come to a fate that neither you or I, I'm sure, is happy about, was a unique undertaking at the time.
No question. And another instance where a great deal of prior planning had taken place. The medical center, prior to Detroit General becoming an integral part, consisted of Hutzel Hospital, which was a women's hospital, the Children's Hospital, Harper Grace Hospital, and the Rehab Institute.
So Harper Grace was a general hospital.
It was
The
general
others were
hospital.
Specialty.
And in that planning, the idea was to create what we call centers of excellence. And Detroit General was going to be the emergency trauma unit. To that end, Detroit General eventually passed its obstetrical service to Hutzel, the pediatric service to Children's. And by the time we moved in, that was all in place. One of the things that was going to also happen was that the other hospitals would close their emergency rooms, and this was the only emergency access to the center. Patients would come into Detroit, and whatever specialty they needed would be then, after they were stabilized, be transferred to the other hospitals.
How well do you think the arrangement worked? Because it was unique as far as I know.
Believe it or not, it worked very well. And when I last checked, don't know the final decision in that regard, but one of the things that they were looking towards was to create one corporate entity to manage the entire center, i.e. there would no longer be a board at each of the hospitals, but there would be one central board that would control the entire medical center, and that it was going to be one corporate structure, one corporate balance sheet, because one of the things that was anticipated and did in fact occur was by shifting those clinical services, it changed the financial makeup and the generation of revenue. And in order to balance it out, if they were put in one pot, it would be certain that no one would be disadvantaged as a result of the arrangement that they were setting up. You should know that here in Louisiana, we thought in those terms from a gross perspective, but it never came into being. But LSU, Tulane, as the teaching institutions, along with, we talked about Children's Hospital coming into the medical center. Those are some of the things that we talked about. Hotel Dieu being a part of it. But we could never get it to gel in a meaningful way. It would have been beautiful could it have been settled.
Tell me about your first week on the job. The state wasn't, as you said, as forthcoming with money as you had hoped, but you had one heck of an introduction.
Well, one of the things that was unique to me and different was the level of pay for the employees at the hospital. Detroit was a union town, and I recall that the lowest salary for the unskilled labor was somewhere around $10,000. I mean, dietary workers, housekeepers. And here, it was like, here in Louisiana, it was like half that much. They weren't even getting minimum wage, to be frank. And that escalated right up through the hierarchy in terms of staff within the hospital. And also, there's the way the system operated. Civil service had the responsibility for reviewing and approving the salary scale. It was up to the department, once civil service had made those decisions, to then apply that and pay the salary approved. And it also needed to be in the budget. And what had happened is this decision had been made on the part of X-ray technicians in the hospital to raise the salary. But there had never been the allocation to pay the salary or pay that level. And it was not up to me to do it. And again, if it's not in the budget, the legislature has not made that decision, then it's up to the governor's office to decide how to handle situations like that. And what had happened was when the announcement came out that it was done and when no action occurred to satisfy the employees, the X-ray technicians decided if they're not going to pay, we're not going to work. And they made that decision on a Friday afternoon at about 5 o'clock. The radiology service is a critical element of emergency service. And if you don't have radiology techs with the trauma that we tended to experience in the ER, there was no way we could have an effective program. So a concerted decision was made that we would need to close the ER for further admission, because by 5 o'clock we were already overcrowded. I mean, the waits in the ER would run better than 10 hours at best. And Friday night was our busiest time, to say the least. Well, this created quite a stir in the city in terms of other hospitals that then had to assume the responsibility for accepting our patients. But more importantly, by Monday morning, this had created a ripple effect through the hospital, because our majority unskilled labor, housekeepers and dietary workers and the like, were concerned that if roughly at that time 20 or 30 X-ray technicians could cause this much of an uproar, and their numbers were many times that this was not fair. So they then created a kind of a sit-in for me on Monday morning. I was attending a staff meeting in Baton Rouge, and I got a call indicating that all of my staff were waiting for me to come back to explain how to handle and how to deal with this mishmash, if you will, in terms of decision making. So that's what you found when you came.
And I forgot to mention that this all was happening in the middle of Mardi Gras, just to make it even more interesting.
The upshot was, and I say this and have repeated it a number of times, there is a value in having a union and union representation, because this was an opportunity to maximize the effective use of union leadership. When faced with a situation like this, it's possible and appropriate, if you will, when there is an illegal work stoppage, that you can terminate the employees who are involved. And that was something that I did not want to do, because they were aggrieved and they had a good grievance. And the issue was to get them to understand that they needed to take a step back and allow management to deal with the issue in a meaningful, appropriate way. And so I met with the union leadership and indicated to them that I would be willing to take a look at salaries. I think it's appropriate to do that. By the way, the governor's office relented and, in fact, agreed to pay the radiology techs the salary as recommended by civil service, and that put that one to bed. But then there was the inequity of the salaries of the rest of the staff that needed to be looked at and handled. And by using the union leadership, I met with the groups, the individuals in small groups, and with union representation. And after I met with them, then the union met with them and clearly indicated to them that help was on the way, change was coming, but it was going to take time, and that they needed to go back to work and allow that to occur. You should know that when I was relieved of my position at Charity and accepted an offer, actually I went looking not at Cook County, but to work with Hyatt Medical Management,
Which was listed Witherall's
which was
outfit.
listed in Witherall's outfit. And when I did go, I was offered, you can either accept the position with us or you can accept the position at the hospital. And at that point I said, I think that I've had enough of public hospitals for a while. I think I'd like the consulting position. And that's the one they offered me. That was in August.
Yeah, it lasted about 5 minutes, as I remember.
Yeah, and lo and behold, in early fall, I was approached by Mr. Litherall to say, Elliot, Bill Silverman, who was the CEO at Cook, is taking an early retirement. And the county board has asked us to have you assume the position of CEO at the hospital. And I indicated that I was not interested and did not want to be the CEO at Cook County Hospital.
And the hospital was in a mess at the time.
That's why they had the consultants there.
Yeah, there were threats of closure. The funding was inadequate. The county was fighting with the state and with the city.
Because the previous public benefit corporation had really run itself in debt, something awful. In the meantime, I was told by Liston that you don't understand, the county is our client and our client wants you and we want to maintain the contract, so you will assume the responsibility.
A little bit of an offer you couldn't refuse.
One that I
as they
could not
say.
refuse. I said, I will take it for a while you look for the CEO. 6 months passed and I approached Mr. Litherall again and said, when are we going to find the replacement? And he said, you are the replacement. And when I went to see the president of the county board, he said, You are, you have been, and you will be.
Was that Dick Phelan?
No, that was George Dunn.
Oh, yes. Well, just for the record, George Dunn was one of the most powerful politicians
No
in the
ifs,
history
ands,
of
or
the city
buts.
of Chicago and the county of Cook. And you didn't refuse his offers either.
Nope. And I didn't. And I lived happily ever after for the next 4 years.
Tell me about your time there. It's, given the politics of Chicago and Cook County, at the time, an incredibly old physical plant in trouble with the Joint Commission. The thing had been built in like 1912. You were there at a very interesting time.
No question, because we followed the Health and the Hospitals Governing Commission, if I remember, and Jim Horton. And they had been in place for almost 10 years, if I remember correctly.
James Houghton, MD, was one of Cook County Hospital's more colorful CEOs.
No question. As I said, the hospital was really in financial difficulty. And the county abolished the Health and Hospitals Governing Commission. The state, because it was a state constituted body, the corporate structure, was abolished by the legislature and returned the responsibility to the county. Once that happened, the county immediately levied a cigarette tax, if I remember correctly, of 5 cents a pack, and all of that money dedicated to the operation of the hospital. And we were smoking like stacks during those days, and the money came in, and before you knew it, there was more than enough money to operate the hospital. Quarters kept so much came in that they even were able to siphon some off to do some other things. But the financial ills of the hospital were nicely satisfied as a result of that decision by the county board. And it's fair to say that during the entire period that I was there, the availability of funding was not an issue. They had a unique way of handling hospital budgets.
Sorry.
They did not consider vacancies as many governmental budgets do. If you have 100 people and you have 20 vacancies, they'll fund the filled positions and not the vacant positions. Well, Cook County funded 100% of all positions that were available.
Including the ones who never showed up for work.
That's right. The issue was, though, during the year, the operating budget for other activities in that line item would find that it would be insufficient. So you'd go to the county, and the president of the board would sit with the department directors and look at what their needs were and move the money out of the salary category that was not used because the positions weren't filled to cover the shortfall in other expenses. The only problem was you had to go through these gyrations periodically to balance and to get the money that you needed where you wanted it. But the other thing about the county was that the hospital was only a couple of miles away uptown, if you will, from the county building. And every purchase over $10,000 had to be approved individually by the county commissioners. So every Monday when the commission met was spent in the halls of the chambers of the county commissioners reviewing all of the expenditures. And that was the most trying, if you will, of the management role and responsibility that I found in that approach.
Well, that would bring up an obvious question that African Americans particularly tend to be very much underrepresented in the executive suite outside of the public sector, pretty much across the board. But do you think the obstacles are easing? Do you think it is getting
I was going
better?
to say that is not as prevalent, or that has been relieved a nice bit. I would say you'd probably be hard pressed to not find minorities throughout the organization across the board. They're certainly out there in numbers. And reading a report from the American College the other day, it was revealed that while they're there, that the salaries still leave something to be desired, but I think it's moved a great deal in a positive direction. I can count on one hand the ones that have definitely achieved, and it certainly is an example that there's progress. But this is an evolutionary issue, and I think it'll change in time, change positively.
Do you feel that health administration is still a good career for young minority aspirants?
Oh yes, without a doubt.
What would your advice be to them in terms of preparing to get into the field?
Well, one of the things that I would also say is that certainly when I came along, the idea was to be a CEO. Well, in those days, you were talking about a hospital. It might be 100 beds, 200 beds, 300 beds. But today, we have systems. And the idea is to get into the management stream, which is a critical issue. And I'm certain that it's not as easy, certainly, to get up to the system level. But certainly, if one starts at the ground level with the appropriate training and background and patience, and bringing the skills that it takes to move up, that one can find satisfaction, great satisfaction and rewards in the field.